Hello friends, and welcome to our second and last lecture on cardiomyopathy. In first lecture we have learned about meaning of cardiomyopathy and then about its classification. So cardiomyopathy is classified as primary and secondary cardiomyopathy, and this classification is based on its etiology. This classification is based on its cause. So if cause is known, then it is called as secondary cardiomyopathy, and if cause is not known, then it is called as primary cardiomyopathy. Why? Because secondary means it is secondary to something, it is secondary to a cause, and in primary cardiomyopathy there is no known cause. So the disease itself, that is cardiomyopathy itself, is first event known. You have to remember here that it is not that in primary cardiomyopathy there is no cause. There are causes, but we don't know them. Okay, so it is about our knowledge, but both have their causes. Then again, primary cardiomyopathy is there is some subclassification. So it is subclassified into three types, that is idiopathic dilated cardiomyopathy, idiopathic hypertrophic cardiomyopathy, and idiopathic restrictive cardiomyopathy. So these are three subclassification of primary cardiomyopathy. Idiopathic means of the thing whose cause is not known. And then again there are further subclassifications like idiopathic hypertrophic cardiomyopathy is classified as obstructive and non-obstructive types, and idiopathic restrictive cardiomyopathy is classified as cardiac amyloidosis, endocardial fibroelastosis, endomyocardial fibrosis, Loeffler's endocarditis, and other forms. So then we learned about in primary cardiomyopathy we learned about idiopathic dilated and idiopathic hypertrophic cardiomyopathy. Now we will start today's lecture, and we will study about the third form of primary cardiomyopathy, that is idiopathic restrictive cardiomyopathy. So its other names are obliterative cardiomyopathy or infiltrative cardiomyopathy. Why it is called as restrictive cardiomyopathy? Because there is restriction in ventricular filling due to reduction in the volume of ventricles. So understand this, there is reduction in volume of ventricles. So obviously if volume of ventricles is reduced, the blood coming to ventricle will be reduced, it will be restricted. So that is why it is called as restrictive cardiomyopathy. And as we have just seen that it includes following, and that is those are once again we will repeat that: cardiac amyloidosis, endocardial fibroelastosis, endomyocardial fibrosis, and Loeffler's endocarditis and other forms. So we will look at this condition one by one. First one is cardiac amyloidosis. So amyloidosis means build-up of amyloid protein in organs. There are if there is amyloid is a type of protein which if concentrated and built in organs, it is called as amyloidosis. And when this amyloidosis happens in cardiac in heart, it is called as cardiac amyloidosis. So is it clear? Amyloid is a protein, and it is built up in various organs, and when it is built up in heart, it is called as cardiac amyloidosis. Second one is endocardial fibroelastosis. So endocardial fibroelastosis is basically thickening of ventricular endocardium, especially in infants. Endocardial fibroelastosis is thickening of ventricular endocardium, and that is occurs especially in infants. Next one is endomyocardial fibrosis. So don't get confused in between these two terms, endocardial fibroelastosis and endomyocardial fibrosis. They are look very similar. So just repeat sometimes and you will be clear about them. So endomyocardial fibrosis is characterized by fibrosis of left ventricular and right ventricular endocardium, which cause restrictive cardiomyopathy. So here there is fibrosis of left ventricular and right ventricular endocardium, and in endocardial fibroelastosis there is thickening of ventricular endocardium. So there was thickening and here is fibrosis. This is the difference. Now coming to next one, that is Loeffler's endocarditis. It is a variant of the entirety described above, that is Loeffler's endocarditis is a variant of endomyocardial fibrosis, and there are some differences basically, but the point to remember is that the Loeffler's endocarditis is much more severe condition than endomyocardial fibrosis. Okay, now there are last one is other forms of restrictive cardiomyopathy. So they are, besides above, restrictive cardiomyopathy may result from various causes, like we will just know them. The first one is hemochromatosis due to iron overload from multiple transfusions or hemoglobinopathies. So hemochromatosis is overload of iron. If there is increased quantity of iron in blood stream, then it is called as hemochromatosis, and it occurs in multiple transfusion. So if there is a overzealous transfusion, like the transfusion is much more than the requirement, then it may cause hemochromatosis. And similarly it can happen in various disorders of hemoglobin also. Second one is myocardial sarcoidosis. Sarcoidosis is a condition in which there is collection of white blood cells called granulomas in various tissues of the body. So when this happens in heart muscles, it is called as myocardial sarcoidosis. Next one is carcinoid syndrome. Carcinoid is a type of tumor, and when it secretes some type of chemicals, so these chemicals cause, when circulate in the blood, they cause this syndrome, that is called as carcinoid syndrome. Next one is scleroderma. It is scleroderma is thickening and hardening of the skin and connective tissues, that is scleroderma. And last one is neoplastic infiltration of in the heart. So this was this here completes our primary cardiomyopathy. Now coming to secondary cardiomyopathy. So basically it is very simple, that secondary cardiomyopathy, it must have some causes, and we will just name these causes. So it occurs due to following condition. First one is nutritional disorders, that is like chronic alcoholism, thiamine deficiency, that cause very heart disease. Next is toxic chemicals like cobalt, arsenic, lithium and hydrocarbons. Then drugs like cyclophosphamide, adriamycin and catecholamines. Then next one is metabolic diseases like amyloidosis, hemochromatosis, glycogen storage disease, hypo and hyperthyroidism, hypo and hyperkalemia. Next one is neuromuscular diseases like Friedreich's ataxia, muscular dystrophies. Then infiltrations, for example leukemias and carcinoma. Then connective tissue diseases like rheumatoid arthritis, systemic sclerosis, dermatomyositis and lupus erythematosus. And then again the point here to remember is that well-known entities like ischemia etc. are not included in this. What does this mean? This means that ischemia and some bowel disease etc. are also cause cardiomyopathies. Like in ischemia there is infarction in there is death and necrosis of cardiac tissues. So logically it should also come under cardiomyopathy, because myocardium is being affected, but it is not included in cardiomyopathy. Why? Because it is a very well known, very well researched and very well studied entity, so it is described separately. So that is why it is not included in cardiomyopathy. In cardiomyopathy the little known diseases are included only, and if the disease is much well known or much well studied, then it is described separately. So remember this point. So here it completes our chapter on cardiomyopathy. So I hope that you have liked this, and if any point is not clear, you can ask in comment section. So keep enjoying and keep studying. Thank you.